Let's talk about shock. The word shock just means that the organs or the systems shut down. So we have the brain. How do we know it's shutting down? Because LOC changes. That triangle is for change, right? The kidneys. How do we know that the kidneys are shutting down? Because the urine output drops below 30 mLs per hour. It goes below that. So that's what I mean by shock. Shock means that there's something going on where the hemodynamic stability is no longer there and the organs and systems are shutting down. We have different types. We have hypovolemic shock. That means that you're losing fluids. It's beyond dehydration. I'm talking about this patient's bleeding out. So you have intravascular blood loss, hemorrhagic fluid loss. It could happen in fluid loss too, like in diabetes insipidus, where you have an excessive amount of antidiuretic hormone. Where you have a deficiency in antidiuretic hormone and an excess in urine output. These patients are losing 18 liters of fluids a day. Those people could go into hypovolemic shock, but otherwise it's going to be more so when you're bleeding out. Cardiogenic shock just means that there's something happening to the heart that's preventing it from pumping adequately, so it cannot perfuse the organs and systems. They shut down. Excuse me. ATI talks about distributive shock. This is an umbrella term for septic shock, anaphylactic shock, neurogenic shock. These three are really important. Septic shock means that you have a profound infection that it's so profound, it's so bad that all the toxins of the bacteria is interfering with the perfusion of the tissues. So your blood pressure drops, you're not perfusing tissues, your organs shut down. Anaphylaxis is secondary to an allergic response where an abundance of histamine is released. Histamine is a powerful vasodilator. And if the histamine is around your whole body, all your blood vessels open, your airway, by the way, closes off, and you go into shock. That's your anaphylactic shock. And by the way, you give epinephrine for that. Neurogenic shock means that you have a spinal cord injury, usually up here, where the brainstem has something that we call the vasomotor function, where it constricts blood vessels to normalize blood pressure. But if you just busted that part of your brain, you no longer have that control. Blood vessels dilate. Again, hypotension, you cannot perfuse the tissues. And the same concept goes in regards to perfusion with drug intoxication or an Addisonian crisis where your body has no sodium, no aldosterone, and you go into hypovolemic shock. So all of these are considered distributive shock. Don't focus so much on being overwhelmed by the variety of shock types. They all lead to the same issue: low blood pressure, lack of perfusion of organs and systems shut down. That's it. And then this talks about obstructive tension, pneumothorax, cardiac tamponade, pulmonary embolism. These are interfering with the body's ability to oxygenate blood to perfuse the tissue. So again, organ system shut down, same thing.